Morning everyone, it's Dr. McQuillan from Berkshire Menopause Clinic. So I just wanted to do a quick video about your anatomy and actually why it's so important that we know the names of our anatomy, especially when trying to relay symptoms to health professionals to help get the correct and safe diagnosis. So let's just go through a quick run through. So we've got our ovaries, our uterus, our womb that is, and our womb is made up of lots of layers. And the innermost layer is our womb lining, the endometrium, and that leads us to our cervix, which leads us to our vagina, which leads us to the outside, the vulva. And this is the vulva, the outer vulva and the inner vulva. So these are our 5 parts of gynecological anatomy. And actually, these 5 parts, you can also get serious conditions like cancer in any one of those positions. So why is it really important we know our anatomy? Because when we're telling health professionals we've got symptoms, it's really important that we are saying the right anatomy so that we can try and give the right diagnosis. So example, if we just say to someone, it burns when we pee, then the automatic thought process goes to, well, you must have a urine infection. Here's some antibiotics. But actually, a lot of women, you have to really delve into their symptoms and find out, actually, when it burns when I pee, it means actually it's on my vulva that it's burning. So actually, this might trigger you to think, actually, this isn't a urine infection. Could there be a lesion on our vulva? Could there be a mass? Could there be a patch of itching or an ulcer on the vulva that actually could be something more serious or a different type of diagnosis? When we say we've got an itchy vagina, again, could this mean that you've got vaginal itching, so higher up here, which could be something like discharge or inflammation around the cervix that's causing itching? In which case, could this be something like an infection? But actually, if you've in fact got itching around the vulva, this outside part, again, there are many reasons that you can get vulval itching. Could it be genitourinary syndrome of the menopause? Could it be a vulval cancer, something like lichen sclerosis? Could it be a vulval skin cancer? Again, something around the vulva. So you can see why these different symptoms can present differently and make a healthcare professional not necessarily get the right diagnosis. So I'm really, really passionate and keen to teach people their anatomy. And also let's teach people from a young age. The younger we know our anatomy, the more in tune we are with our body. The more in tune with our body, the more empowered we feel about health. And actually knowing what's right for us, what's normal for us, means that we can identify when things are abnormal. So I really hope that helps.